Whenever the question, why do you want to come to the US is asked, most graduates tend to focus their answers on the US healthcare system. This is true not only during residency interviews, but also when sending cold emails for observerships and clerkships. Students often emphasize their desire to understand the US healthcare system. However, when the same question is posed during interviews after the student has completed their observership or clerkship in the United States, their response still focus on the US healthcare system. When asked for specifics about what the US healthcare system entails, many students highlight aspects such as cutting edge technology and research. Is this the complete picture of the US healthcare system? The answer is no. Let me guide you through a little journey to help you understand the US healthcare system. This will make you feel more confident and prepared when speaking to the interviewer. Imagine this. You're wandering through a lively food market filled with energy. People are chatting, and colorful stalls are packed with everything from fresh fruits and veggies to delicious gourmet meals. This vibrant market represents the US healthcare system. Just like any bustling marketplace, there are important players here working together. Let's imagine a little marketplace for healthcare services. First up, we have you, the customer, or as we like to say, the patient. You are on the lookout for the best healthcare service out there. Next, we have the providers. Think of them as the farmers, chefs of our healthcare market. These are the doctors, nurses, hospitals, and clinics all dedicated to taking care of you. Now, here, where it gets interesting. You cannot simply pay for the services right away. Instead, you need a special meal ticket. You get this ticket from our third important player, the payer. This could be your health insurance company, your employer, or even the government. Sometimes this ticket covers all your costs, sometimes just part of it. And occasionally, you might still find a little balance to settle at checkout. Let's understand the concept of meal tickets. That's our health insurance. Most folks in the United States don't pay for healthcare out of pocket. Instead, they get insurance, which is kind of like a subscription plan. There are two main types. Private insurance, this is what you might get through your job or directly from a company. Or government insurance, think of programs like Medicare, Medicaid, or the VA. Imagine it like going to a buffet. With private insurance, your subscription could cover a lot of tasty dishes, but you might still have to fork over some cash for that fancy drink. If you are on Medicare and Medicaid, you might find a different selection of options available. It sounds easy enough, right? Oh, wait, there's definitely more to unpack in this system. Let's dive into a bit of a tricky topic. In United States, we have this thing called fee for service model when it comes to healthcare. Basically, healthcare providers charge for each individual service they provide. You can think of it like taking your car to a mechanic. Instead of paying a flat fee to get your brakes fixed, you end up paying for every little part, tool, or even the time it takes to explain what's wrong. And it can add up pretty quickly. And here is the surprising part. Patients often don't know how much they owe until the bill arrives weeks later. It's kind of like going to a restaurant where you enjoy your meal but don't find out the prices until you get your credit card bill. Let's break down some important terms: premium, deductible, and copay in a friendly way. Think of a healthcare insurance like a gym membership. Premium. This is the monthly fee you pay just to enjoy access to the gym, or in this case, healthcare. It's like your subscription. Deductible. This is the amount you need to spend out of pocket before your insurance starts to help out. You can think of it as paying a bit extra for that cool new workout equipment at the gym. Now, copay. This is like the fee you pay every time you want to bring in a personal trainer for a session. It's that little extra for using a specific services. Even with insurance in hand, there are often some extra costs to consider. Most folks in America get their insurance through their jobs. This means both employers and employees pitch in to cover the premium. However, here is the tricky part. If you lose your job, you might also lose your insurance. That's where some helpful government programs come into play. For example, Medicare. Think of it as healthcare discount just for seniors available for those 65 and older. Medicaid, and imagine it as a support system for low income families to help cover health care costs. Veterans Affairs or VA, it's like a special club just for our brave military veterans, providing them with healthcare services. Let's answer the big question. Why does healthcare in the US cost so much? There are a few key reasons. Administrative overhead. With so many players involved, like insurance companies and billing departments, it can feel like a complicated maze of expenses. Second, drug prices. Unlike some other countries, we don't have regulation to keep pharmaceutical prices in check. So companies set their own rates. Third, fee for service model. This approach encourages healthcare providers to perform more tests and more procedures, sometimes even when they are not really needed. And the fourth, malpractice insurance. Doctors often need to purchase expensive insurances to guard against lawsuits, and these costs end up getting passed on to the patients. It's a complex mix that makes the US healthcare system really innovative, but also a bit frustrating for many people. What's the catch? While the US is a leader in innovation, offering cutting edge treatment, groundbreaking research, and gives patients a plethora of provider options, the issue of accessibility tells a different tale. For those without insurance, even basic healthcare can be prohibitively expensive, and it's no surprise that medical bills rank among the top reasons for bankruptcy. Before hailing the US healthcare system or criticizing your own country's system, take a moment to pause and reflect. Consider it carefully. Next time someone asks you why you are choosing residency in the US, take a moment to reflect before responding. You will have a better and honest answer. Good luck.